Good evening, everyone.
Welcome, welcome. Thanks, Docs,
Hi,
for making it.
happy
Hey, Dr.
Sunday.
Khan.
Oh, can we still say Happy New
Yeah,
Yes, we
Year?
can.
absolutely.
We're still in January.
Yeah.
Happy New Year.
Happy New Year. So we just sent out the final email to let everyone know that the meeting started. So we're going to give everyone 5 minutes to find their way in. In the meantime, our secretary Dilly will lead an icebreaker. And Dilly, whenever you're ready, you can unmute.
Yeah, can you guys hear me?
Yes.
Yeah. Hi
Yes.
guys, my name is Dilly and I'm the secretary for Ambitious Dentists. So I know everyone here might not want to necessarily specialize, but just in case, like if we have a question here, it says, if you were to specialize, what would it be in? So that would be a great question to ask. If you can say that along with your name and school and what year you go to, that'd be great. And I can start. My name is Dilly. I go to Rutgers. I'm a D3. And as of right now, I want to stick to general, but if I wanted to specialize, I would go with ortho. So, next.
I guess I'll go. Hi, my name is Alexis Jackson. I am a D2 at Meharry, and if I were to specialize, it would definitely be pediatrics.
Hi, my name is Zaria Hadnot. I am a D2 at Meharry as well. And if I were to specialize, I think it would be oral surgery.
I can go. My name is Lami Damachi. I am a D2 at Temple University, and I plan on specializing on OMFS.
I can go. My name is Natalie Lamina. I am currently a D3 at University of Pennsylvania School of Dental Medicine. And if I were to specialize, I'd probably specialize in ortho.
Hi everyone. My name is Moji Olayemi. I'm a D2 at U of L. Um, I'm not sure if I want to specialize yet, but if I do, I think I would want to go the more cosmetic route with like crowns and veneers and everything.
I'll go. Hey everyone, I am Dr. Rachel Kayongo. I am a recent grad from UDM, May of 2024, and I'm looking into applying to ortho.
I'll go next. Hi, everyone. I'm Rebecca. I go by Becky. I'm a D2 at LMU, and I hope to also specialize in ortho.
I'll go next. Hello, my name is Kiana White. I'm a D2 at UAB, and if I were to specialize right now, I'm considering pediatrics.
Hi, I'm a D4 at Detroit Mercy, and I plan on specializing in ortho.
Hi everyone, my name is Nana. I'm a D3 at UTL San Antonio, and if I were to specialize, it would be in Peds.
Hi everyone, my name is Paula. I'm a D4 at UCSF. And if I were to specialize, it would be in endo.
Thank you, everyone. We are waiting for one more doctor to join. Also, was there a meeting passcode? Can someone let me know? Because I'm seeing here that some people there was not a meeting passcode. Okay, just one moment.
No, Precious, I'm on a friend's I'm on a friend's computer. And so the link was a little bit hard for me to pull up.
through their computer.
Gotcha. Okay, because yeah, someone else just asked for the passcode. Yeah, I was just making sure. And so we'll get started at 6:10. Thank you again, ladies, for your patience.
That's East Coast time, right? It's 6.
Correct. We're actually getting started
Okay.
now. I just
Okay.
okay. Okay, so pull up the slides. So thank you, Dilly, and thank you everyone for joining. It's great to see that so many of you want to specialize. Congrats on making it this far. And yes, if you're here, it means that you're more than likely considering specializing. And I hope that by the end of this panel, you will get some clarity. This is a part one of a two-part series where we'll discuss about specializing in the different types. And before we get started, I just want to say thank you to the lovely doctors that have been so kind to volunteer their time to speak in this panel discussion. If you all can turn on your cameras so the doctors can see you, that would be great. We'll go ahead and get started. Oh, our first panelist, we have Dr. Raven Alexander, a proud graduate of Meharry Medical College dental program. She completed her orthodontic residency at Case Western Reserve University. Welcome, Dr. Alexander.
Hi, ladies.
Then we have Dr. Portia James, a Dallas, Texas native. Dr. James earned her DDS from Meharry Medical College School of Dentistry, served as a captain in the U.S. Air Force, and completed her oral and maxillofacial surgery residency at Meharry and Nashville General College. Welcome, Dr. James. We have Dr. Sarah Kwong, who attended the College of Physicians and Surgeons of Columbia University at Harlem Hospital. She completed the Advanced Endodontic Certification and MS in Dentistry at Case Western Reserve University. Welcome, Dr. Kwong. And we have Dr. Tiana Osborne, born in the Bronx and raised in upstate New York. Dr. Osborne is a dedicated pediatric dentist who completed her residency at St. Barnabas Hospital as chief resident, earning the prestigious First Place Resident Research Award. Welcome, Dr. Osborne.
Thank you.
So
Happy
this
to be here.
Okay. So this month's panel discussion aims to inspire and inform students considering specialization by sharing real-life experiences and challenges. The goal is that everyone will leave here feeling a bit more confident about their next step in their dental journey. During the first half of the meeting, our panelists will spend 2 to 3 minutes to answer questions about their journey and their specialty. We'll take a 5-minute break afterwards to discuss some updates to look forward to within the Ambitious Dentist Mentorship Program. And lastly, we'll open the floor for a Q&A. Okay. So we'll start off with the first question. Doctors, on the lower right, you'll find your name, and that's the order in which we'll answer the series of questions. And question number 1 is, what inspired you to pursue your specialty, and how did you know it was the right choice for you? And if you can also follow up on when did you decide which specialty you wanted to apply for? Dr. Alexander, you're welcome to unmute and answer this first question.
Hi, everyone. So I don't know if you guys are even old enough to even know what like WikiHow is. Do y'all remember that? To like kind of Google different things and it would just tell you like how to become so and so. So I decided that I wanted to be an orthodontist maybe around like I think I was 16, and I remember I had a gap between my front 2 teeth and I hated it so much, so I begged and begged my father to like for braces. Once I actually saw my orthodontist, well, my dad would always bring me around dentists who looked like me. So all of my dentists were Black females once I told him that, that I wanted to go into dentistry. So once I saw my orthodontist, I love my experience, the confidence that I built, after having braces. And then I also kind of just saw what what the lifestyle looked like. It was always kind of very happy, very cheery. And I'm a happy, very cheery person. And that's kind of like what ortho is. I also, did a lot of shadowing, and I did like oral surgery and stuff, and I literally almost passed out. And so ortho is kind of more like a clean thing. You maybe see a little bit of saliva, but not too much blood. But then I feel like you get to spend like a lot of time with your patients because it's a treatment over 2 years. So it kind of builds like a whole family kind of thing, which I really enjoyed that. And so like I initially, again, like around 16 is when I decided I was going to do it. And I Googled how to become an orthodontist, and then literally WikiHow says step 1, 2, 3, 4, 5, 6, 7, and that's what I did. How did I know that was the right choice for me? Just the whole personality feel, like again, happy, cheery, building relationships for long experience of time. I just really liked it.
Thank you for that,
Just chime in.
Dr. James.
Oh, okay. My path was a little bit different. I honestly, I love the idea of specializing, but I was not sure if I wanted to have the time commitment once I graduated from dental school. So, my pathway is a little bit different. I went to the Air Force after I graduated for dental school, and I did an AGD, and my first base, was overseas. I lived in England. So when I was in England, they have slated to have two oral surgeons. However, at that time in the Air Force, they were short oral surgeons. So where they were normally supposed to have two, they only had one. And then he knew that I was interested in oral surgery. And so the oral surgeon there was like, "Hey, I know you like doing this. How do you feel about going to the OR with me?" And so I was like, "Okay, that's fine." I guess. And so I used to go to the OR with him on Mondays, and then they devoted a couple of days a week for me to just do oral surgery in the clinics, because when you're overseas, you treat the whole family. You treat, of course, the active duty members, you treat the family members, and you actually treat the veterans that are still in the area. So um, that allowed for me to have a lot of experience in oral surgery, to kind of see it in a different light. And it just made me have a little bit more confidence in order to apply. So I was a general dentist for 4 years. And then I went back and I applied for residency afterwards. So really and truly, although my pathway was a little bit slower, it was definitely worthwhile for me to be able to do those things and to have that military background, that military experience. And so ultimately the confidence that it took to allow for me to apply. So I feel like that afforded me the opportunity to gain the confidence and do, what I'm going to do for the rest of my life. So I'm very grateful for that opportunity that I had.
Thank you. Dr. Pong, you're up next.
I kind of went the delayed route too. In dental school, at Detroit Mercy, I would get the oral surgery attendings pulling me out to come be in oral surgery because I knew I had an interest in oral surgery. Then I would have the pediatric faculty pull me out of the clinic to come be in pedo to assist any one of my classmates. But in order to buy me some time, I went and did a GPR. And at the GPR, I was really toggling between pedo and oral surgery. And come to find out, it did not suit me well. So on the days at the GPR in New York, I really took a liking to endo because on the days that we had endo, I was able to play my music. I would have, a patient present. I could think, I could process what I'm doing, focus solely on this tooth, focus on getting them out of pain, building a quick relationship, and it was an instant fix. And from there, I was like, I want to do endo. So I really kind of had to change up I had already started the application processes for pedo and possibly oral surgery. And I mean, I literally had 2 months to now switch everything towards endo and try to meet the program directors and try to find my way into an endo residency program.
Dr. Osborne, you're still muted.
Okay, thank you. For me, I was like Dilly had said in the beginning about wanting to be a general dentist. Dental school is a lot. It was a big adjustment for me. I really did not like growing up. I loved going to the dentist, and I really thought they only tapped teeth. I never had a cavity, so they would just come in after the hygienist, tap a couple of teeth, and go about their business. And I said, "Oh, this is awesome." It wasn't until I got to dental school and I realized, this is a lot. So with it being a lot, it's kind of hard to choose a specialty. I had initially said I wanted to do oral surgery going into dental school. I thought, doing all those prosthetics and the surgery just sounded so prestigious and so cool. Um, but at the end of the day, like Dr. Alexander saying, like it has to be a personality fit. Like you have to find something that works for you in order to thrive. So when I got out from dental school, I went to a GPR in the Bronx. And that was mostly because I did want more experience. I was afraid to jump straight from, let me not say afraid, but just I wanted a little bit more of a transition from dental school to seeing patients. You go from seeing two, three patients in a day, and then when you're practicing, you jump to 7 or 8. So and then there's so many things you could do with general dentistry. So I just found it very difficult to choose. So practicing and doing a GPR gave me time to figure out what my strengths were in dentistry. Uh, I thought I wanted to do oral surgery, but I realized, during my oral surgery training and residency, the follow-up is disgusting. Like I just don't like the way people heal. It looks so gross. Um, but it wasn't until I got an endo. Like endo is nice, you get the kids out of pain, but it just takes so long. You have to be like really focused. So for me, when I was practicing as a general dentist, I found that the most fun part of my day was working with the kids. Even though it takes a little bit more time, making it a good experience for the children made it fun for me. So And that was probably like my second year practicing. So probably 3 years out of school, I decided I wanted more training in pediatrics. So um, I applied to pediatrics, didn't get in, and I pivoted to do a special needs residency so I could still get that behavior management experience and going to the OR. And that was just amazing. I would highly recommend that. I went to Stony Brook to do a developmentally disabled fellowship. Um, so I learned a lot there. And then the following year, I applied for pediatrics again, got in, and it really has been a good fit. I can't say that I'm like the most bubbly, outgoing person, but overall, my personality is very calming. So being able to just use that part of my personality for the patients to, just help relax them, talk them through the procedures. It's fitting for me. It fulfills me in that way. Um, and yeah, so like that's why I enjoyed pediatrics and that's why I chose it. It wasn't my first choice, but after practicing, you know, seeing what works, definitely helped me decide.
Thank you for all those answers. We're going to go to the next question. I believe Dr. Alexander's computer froze, so she'll join us momentarily. So we will skip over to Dr. James for number 2. What are the biggest challenges in your specialty and how do you handle them? And if you could follow up with what was your greatest challenge in applying for and during residency?
Oh Lord, if I can do this in reverse, the whole challenge of residency was a challenge, a challenge, especially being a woman in a male dominated field. But as far as my biggest challenges in my specialty and how I handle them, I would say my biggest challenge is probably managing patient expectations, specifically depending on what we do. So, for example, if I'm doing something simple, extraction, hey, you're going to have some discomfort, you're going to be in these pain medications. That's pretty, I think people kind of understand that. Even with like if I'm doing an orthodontic case or something like that, kind of talking to them about, hey, some numbness, tingling, things like that, that they could potentially have. Usually it goes away, talking to them about that. But when it comes to like bigger procedures, like if we're doing an all-on-4, which is like full mouth implants, where they have spent a ton of money on, managing those expectations becomes a little bit more of a challenge because in the patient's mind, I've spent X amount of dollars. I should like have no complications or anything like that. And so that's where the challenge becomes. And so what I've found, and this is just after just experience and working for so long, um, I'm pretty good about telling them what to expect. I always like to tell them to expect the worst, hope for the best. Because anytime we make an incision anywhere on the body from head to toe, you're going to have some level of potentially a complication that can happen. And I think when I'm able to kind of talk to them, especially if it's a woman, hey, if you had a C-section before, you got this C-section scar, you might have, it might be 20 years later, but you might have one spot that never quite felt the same. It might be numb. And so sometimes when I try to educate them and explain things in those kind of ways, kind of in layman's terms, I think that they tend to have a better level of understanding. And then that goes into your informed consent anyway. So I think managing those expectations and thoroughly educating patients has been the biggest challenge that I've had, and getting the patient that has no medical knowledge to understand why. So I personally think I'm pretty good as far as explaining those kind of things to them, because I tend to spend a lot of time with my patients, especially if we're doing bigger procedures, because I want them to really, really know what they're getting into. And I want them to hear it from me as opposed to hearing it from my assistant or a Facebook group or something like that. So I think that's very important when it comes to that patient-doctor relationship. Now, as far as my greatest challenge in applying for and during residency, like I said, residency itself was a challenge. It's very in a surgical specialty. When we talk about having certain hours that you're supposed to work like 80 hours. That's never gonna happen. You're always gonna work more than that. And so I think that was a challenge, adjusting to that time frame of how residency is, like the random hours that you tend to work. Because for me, I was a general dentist before, so I was in the military. So I work, if we working from 8 to 5, that's my hours, unless I'm on call that week. But in residency, we clinic might start at 8 o'clock, but the night before, if you were on call, you may have been to the emergency room by 3 or 4 times that night. And then you got to see your patients that's in the hospital. So I've rounded on my patients at 5 a.m. that morning to see them. And then I got to make it to clinic for 8 o'clock. And then if we're doing lecture in the evening, I got to do that too. So it's a challenge. It's a lot, but you have to look at it as that we're looking at this for the long term, for the longevity of everything. So sorry, y'all. That's my baby. I got 2 kids, y'all. So you have to look at it for things that are in the long term of things. So I know this is challenging for now. It's temporary. We only got to do this 4 to 6 years, depending on how you're doing, if you're doing a 4-year or if you're doing a 6-year program.
Work hard now, enjoy later. Thanks, Dr. James. Dr.
Work hard, play
Alexander.
hard.
I'm gonna piggy off of what Dr. James said, piggyback off of what she said. Um, her training in oral surgery, I had to endure that something similar in GPR for 1 year. So that was an eye-opening, and what really pushed me into endo is that I did not want to do what she did. But in endo, the biggest challenge, there's two big challenges, is you have a short amount of time, I mean, maybe 5 minutes to build a relationship with the patient immediately. And two, once you build that relationship, you got to convince them to do the treatment if it's going to be a good prognosis or not. So you really have to know your literature and what you feel comfortable in terms of the procedure. Next biggest challenge is everything that we do in endodontics is completely reliant upon the next dentist. There is not one specialty where everything relies on somebody else. So if you don't have good restorative knowledge and can't communicate with your dentist about, hey, this may not be restorable, this may need crown lengthening, this can't take a post, you are absolutely going to be in trouble as an endodontist. The restorative background is very, very much so more important than just learning endodontics and how to root canal the teeth to the proper length. It very much so requires you irrigating and knowing what type of bacteria you're dealing with, and then also knowing that, honestly, the skill sets of the next person who's going to see the patient after you. There's been plenty of times where the root canal looks great, and they say this in literature, it could be a great root canal. And if the crown has open margins, you're literally looking at a less than 50% success rate. So that lets you know that everything that I do is dependent upon the next person. It could be a great crown. Everything is closed margins, and I did the root canal to perfection. And patient is still having biting down pain. And the dentist will say, oh, the endodontist needs to do the root canal. I can see adjustment needs to be made. Patient will come back to me and I have to do a bite adjustment. And then it fixes the problem. So everything relies upon knowing, not just only your skill set, but also knowing restorability too, as well, and being able to communicate all of this within the first 5 to 10 minutes of your consultation ahead of time prior to you starting treatment. And they gotta like you. And they gotta like you, because if they're in pain afterwards, it helps a lot that they like you. Beforehand, you explain everything. My assistants will explain everything, and I repeat everything that they say, and then I repeat it after treatment, just because patients forget all the time. So it's just always good to know that we're always pushing post-op instructions, pre-instructions before treatment, post-op instructions after treatment, just to make sure they're leaving there feeling comfortable knowing what to expect afterwards, at least as much as possible. During residency, my biggest challenge was that my residency required a master's in science of dentistry. So with also learning endodontic literature and doing presentations and treating patients and cases, as well as residents, we also were responsible for some of the undergraduate students. We also had to have classes in dentistry as well, meaning that we had to have like in-depth microbiology classes, in-depth pharmacology classes. So I think that was a little bit more of a challenge than anything. And then we also, at the end, had to have a thesis completed and published. So that was definitely a challenge.
That is a big challenge. I went to a hospital-based GPR, so it wasn't, well, I should say it wasn't like a master's program, but I can imagine how challenging that is, like trying to get a thesis out, and still juggling your clinical responsibilities and personal. Um, but I would say the challenges for pediatrics is managing two patients. You're managing the parents and the patient and their dental phobias. A lot of times the parents come in with their own unresolved dental anxiety and fears, and they project that on their kids. So also piggybacking off what Dr. Quang said about getting these patients to like you and trust you in this short amount of time. Uh, is very challenging, especially when they come in with these preconceived notions. So it's like you're fighting an uphill battle. But I think that's where the beauty of dentistry is. It's really a relationship between you and your patient. So being able to develop and foster that, making the patient feel comfortable and calm, however you may do it. I feel like I was saying earlier about my calm personality, like just explaining everything to the patient and parent, like before you do it, and managing their expectations for like outcomes. When they know what to expect, they feel a little bit more relieved when the things happen that you say are going to happen, and then it's resolved by how you say it's going to. Then that also builds confidence in you as a provider. uh, Sometimes I could say it feels like being managing the patient and the parent, it kind of feels a little bit performative in the sense, you're trying to make it a good experience for the patient, and in turn, like watching the parent watching you interact with their child, you also can trust that way. So you really want to make sure that you're listening to the parent's needs and concerns as well as your patient's needs and concerns. Um, for me, the most challenging part of residency was, I would also say, like what Dr. James was mentioning about the hours not being quite set. We can show up to work. It could be 9 to 5, but if a patient's still in the clinic and work needs to be done, or if you're on call, you're the one that needs to stay behind to get it done. Same thing about being back in the morning. You could be on call all night, have all these people calling you for these different dental emergencies, but you still got to show up and be on your A game the next morning and want to be happy go lucky for these patients. It's a lot, but yeah, those are the things that I would say would be the most challenging for overall in pediatrics and for residency.
So a lot of you guys kind of already touched on a lot of things. In residency for me, I think I went to Case Western as well as Dr. Sierra. So I also had to do a master's. So it's a whole lot trying to do a master's, a thesis, and present as well as your clinicals. And similar to pedo, ortho is also about managing the parent as well as the patient, because most people who have braces are adolescents. So you want to see them from like 7 up until, people who still have teeth. So if you have a 7-year-old or, someone in middle school or high school, you have to build a relationship with the patient, also build the relationship with the mom. But I think any profession in service, like when you're doing something for another person, is just about managing expectations. And even, but with ortho, it's long term, or at least like longer than one filling or one tooth that you're doing. You have to deal with these people for 2 years. And I have also learned that even that's not in this practice too. Sometimes you may have to say no to some of these cases, because if the mom or the dad is, crazy, can you deal with this for the next 2 years? It's like, I'm not just doing one filling on your tooth today. Like, I'm going to see you every 6 weeks. And it's like, I've had the experience before, and I've learned that all money is not good money. And like with that relationship, I don't want to see a patient's name on the schedule and like, they're coming today. Like, that's one thing that you don't want to have to do. So, deciding which cases that you are going to take to. With ortho, another, I guess, difficulty is also, it's not just on you. Like I think someone else was saying about endo, it depends on the next doctor or how that success goes. This is a relationship with you and the patient. Sometimes people have. You ever seen people with the rubber bands in their mouths? The the quality of your work sometimes deals with the patient and their compliance. So if you didn't wear your rubber bands, or you didn't do what I told you to do, and now I did my part. I can't go home with you and put the rubber bands on your mouth. But you know what? When you come and the mom is mad, who they're mad at? Well, you didn't do. I told them I did my part. you know. So that's another difficult thing. It's just like patient compliance. Making creating that trust with them. The showing them the importance of the instructions that you're doing, telling them not to eat hard, sticky, crunchy Takis, Jolly Ranchers, everything else. It just kind of sucks that the quality of your work also deals with someone else. like a group project, when you're the only one doing all the work like that. um I think those are probably like the main two for me, because you always want your work to come out so nice, and then when you're depending on someone else, it sucks when it doesn't come out exactly how you want it to.
Well said. Thank you, ladies. I would have to admit, I just got my Invisalign treatment completed and my dentist chewed me out. My orthodontist chewed me out for not wearing my retainers. I apologize. I've done better since then. So our third question would be, what's the most rewarding part of your specialty and how has it impacted your career satisfaction?
Am I going again first?
Yes.
What's the most? I think the same thing that happened for me. Like, you see kids that come in and they're so shy, they're so timid, they laugh with their hands over their mouth. And then, ortho does take some time, but when you see this kid grow up from this little kid to now this like adolescent kid, and they're so much more confident just from the work that you did, that gap is closed, they can laugh, and now they're smiling everywhere. That's the most rewarding part for me, because I know how I felt, and to give that to someone else, to build that confidence in that other person, it's really cool. And I'll really quickly tell y'all a story. I had one patient, it was like a guy, maybe he's still like early 20s or something, and I finished his treatment and he was like, I was trying to go out with this one girl, and I guess she didn't want to talk to him before he had his braces, but now he's like, now she's all on me, and I'm like, that I built that confidence for him to go and talk to this girl, and now he's going on a date with this new girl that didn't want him before because his teeth were messed up, and so I thought that was like the cutest thing for him for that. And then what's the next part of this question? Um, you go home happy that you made someone else happy. Also, like with your job in general, like it took you a long time to get here, but you also make good money. So the financial freedom that you do have is also enjoyable as well. So I would say confidence and then the financial freedom.
Yeah, I definitely can piggyback off of that. Um, I think for me to, I guess to witness the life-changing impact of the work that I do for people, specifically stuff, I like doing hard cases. I like doing challenging cases. So when I have someone, when they're at a point where they're at end stage dentition and we're going to talk to them about, if we're going to do all on four on them, where we are completely taking out all of the teeth and we're putting in full mouth implants and we're going to give them a new smile, doing a whole complete smile transformation to where you see this person one day and then the next day they look like a completely different person. And we do a smile reveal on them. And, you know, depending on how they started and to how they will be within 24 hours. And when they start crying and things like that, I was like, man, I didn't used to be a sap like this, So so when they start crying because of the work that you did for them, it and you have instilled a new confidence or like an inner glow like within that person because of that new confidence that they have. Because let's be honest, when you see somebody, especially in our industry, the first thing you're gonna look at is their teeth. So from now, so when you see somebody, when you saw them previously and then you see them today, the new after you've made that transformation, like they're like a different person. Like seriously, they are a different person. And so for me, I think that is the biggest impact on me because I like stuff. It's gonna touch you on an emotional aspect. It's gonna touch you on an emotional point of how they feel. And so when they feel so much joy on the inside, you're going to feel the same way too, because the struggles that that person had. And then you hope that as a result of all of the hard work that everyone has done for this patient, that they're going to maintain it. So that's always my worry. But I think that's the most impactful on me, on my career satisfaction, is to be able to allow a transformation from someone that can reflect from inside to outside. So that's me.
Right. So I don't get to deal with the cosmetic end. So sometimes I wish I could be able to see what you guys experience. Um, but I I actually deal with patients who are terrified and they'll never let me know it. The ones that do tell me they're terrified of getting a root canal, I heard all these bad things about it. I'm not nervous about them. At least they've expressed that to me. So now I know I can manage that. The ones who don't tell me, but I can see it in their body language, those are the ones I get a little bit more nervous about, especially the males over 40 with the injections. So they tend to surprise you in the chair. So I would say rewarding part is when I'm done with the injection and they're like, that wasn't that bad. And I'm like, okay, great. Now we got to get the root canal done. So that feels good. Um, Second part would be after the root canal is done, and I text in the evening time to follow up to see how they're doing. And they're like, oh my gosh, I can eat, I can drink something cold. Oh, I'm at the bar. Thank you. Whatever they got going on, they went back, on with their lives. Like nothing, they didn't miss a step, even though they were in pain for like 1 to 2 weeks. And then I would say the most satisfaction is when you are looking at the CBCT and you see it's 5, 6 canals, and you're like, okay, I got this. And it's a huge infection. And they come back 6 months later, and or 6 months to 1 year later for a recall, and it's completely healed like nothing ever happened. I want to say that is definitely the most rewarding experience as an endodontist, is to know that what I did and went in there worked, and they get to keep their tooth.
The good thing about me is probably 90% of my patients are asleep.
That is how half of my week looks like. I spend 2 days in the OR, and that is one part I enjoy about pediatrics is having the kids sedated. As much as I enjoy like making it fun for them, sometimes they just have a lot of work to do. Kids only have like with primary dentition only 20 teeth, but sometimes I have kids that have a cavity on every single one, and you got to take care of that. And I can like the pediatric dentistry, like the work is pretty easy, but it's getting it done a moving target. So sedation is definitely a game changer. I don't know what I would do without it. I don't think I would enjoy practicing pediatric dentistry if that wasn't in my arsenal. So sedation dentistry is a thing. I would say I wish like in terms of specialty, I wish I did dental anesthesia after going through pediatrics. I love pediatrics, but it's something about sedation and dentistry. There's some people like as much as you try, they just gotta go to sleep. They just need to be just put down so they can get through it. But for me, the most fulfilling part of practicing pediatric dentistry is getting kids to say that they actually enjoyed being there. Like that positive, like who doesn't like positive reinforcement? But at the end of the visit, when the kids hop out the chair and they're still smiling, they say, that wasn't that bad. I had fun. I like being on the laughing gas, and they're getting prizes and they walking out happy. That is definitely the best feeling. I would say, of course, all patients aren't going to be like that, but usually in those scenarios, the parents are grateful. Like I said, I treat special needs patients. So it's a vulnerable population where a lot of providers don't have the training or confidence to treat them. So it leaves very few providers to actually provide a service that will like even take their insurance or actually do the work. The parents can be incredibly grateful that you just did the work. Um, so knowing that I like genuinely helped someone that probably couldn't be done by anybody else, you know, makes me feel good, makes it rewarding for me. Um, yeah, those are the two biggest things I would say. Just making the parents happy and making the patients happy makes me happy. Very cliche.
Thank you, doctors. That does it for part one. I definitely feel a bit more inspired, and I just want to give you all a break right now. If you need to, go ahead and take a few moments to grab some water, and I will share some updates with the group. Then we'll start on part two. So last month's panel discussion was centered on AGD versus GPR versus private practice. And we also had a resume building workshop. In case anyone missed it, the video is now up on our YouTube channel. Just search The Ambitious Dentist on YouTube and you should be able to find it. And if you do feel like specializing may not be for you, I definitely recommend watching this as it talks about other options from dentists that have decided to follow the AGD, GPR, and private practice route. And other exciting news, our part two of the specialist panel is coming up at the end of this month on Sunday, January 26th at 5 p.m. Central. RSVP, you can RSVP on our Instagram at The Ambitious Dentist. Our panelists include Dr. Eva Boldridge, she's a prosthodontist, Dr. Tamara Willis, periodontist, and Dr. Tanya Bissoon, general practitioner. I definitely recommend you come pick their brains and learn why they chose this route. You never know what your future holds, so RSVP on our Instagram. And last, we have at our school, a couple girls in the Ambitious Dentist Mentorship are hosting a Galentine's event. So we can get together with other girls at our school who are not necessarily in the club. We're just going to have a fun night of self-care and talk to them about the benefits of being part of the Ambitious Dentist Mentorship Program. If you guys want to host one of your own at your own school, that would be awesome. And if you do, take pictures and let us know how it went. And if you need ideas on how to throw Galentine, send us an email. Or if you're in the New York/New Jersey area and you want to join, let us know. This mentorship isn't solely about networking and professional growth, but also about building supportive community where you can uplift and inspire one another. So I definitely recommend you guys trying this. And lastly, follow us on our Instagram account. It's mainly through our Instagram that you will find updates on upcoming meetings and events, as well as links to RSVP. So if you haven't already, follow us on Instagram at The Ambitious Dentist. That's dentist with an S. And for our final half of our meeting today, I'm going to open the floor to anyone with questions. Please raise your hand and then I'll ask you to unmute, or you can ask questions in the chat. The questions on the screens were sent to us beforehand, so we'll swap between answering these questions and answering questions from audience members. And doctors, for the sake of time, not everyone needs to answer the question, but if you feel that you could provide some insight, then by all means. And whenever we're ready, we could get started. One moment. Hey, Rebecca, I see your hand is raised. You can go ahead and ask your question.
Hi, everyone. Thank you for all the advice. My question is, if someone wants to be in private practice eventually, would you recommend starting off right off the bat, or do you recommend working as an associate first?
I personally would recommend working as an associate first. You shouldn't be afraid to, jump in if you feel like that's your calling for dentistry and you have the experience, go for it. But a lot of times, for me, I did really not know much about dentistry. I can't say like I had anyone that worked in a dental office, like my parents weren't dentists or anything like that. So I was learning that off fresh for the first time, and just spending some time doing different things gives you idea of, what you like and what you don't like. You can be an associate and decide that, you don't want to juggle patient care and the responsibilities of owning a practice. So associating first just gives you, get your feet wet in dentistry and you can go. But that's just my opinion. By all means, like I feel like, you could definitely still go in. I think it just would be a little bit more of a learning curve.
Yeah, I agree. I've done it all. I've done, I've worked as an associate, I worked in corporate, worked in the military, and of course, private practice. So I can tell you the pros and cons of all of those things. Working in a corporate office, for me, I got very fast. Whereas coming straight out of residency, when you're only seeing so many patients to where you're forced to see multiple patients a day, you definitely need, doing private practice staff. So you're no longer going to be able to see one patient in the morning and one patient in the afternoon, like in dental school. So you definitely need to be able to understand that when you see your patients,
So they are absolutely 1,000% correct. And when you guys say owning a practice, I want you guys to understand owning a practice is running a business, which means that now you have put on an extra hat to wear. So not only are you, let's just say you're coming straight out of dental school or straight out of your specialty, going straight into private practice, your own. You are now have to figure out how to set the precedence in your office, manage employees, and then in addition to that, deal with the business aspect of billing, receivings, insurance. And I think the number one rule they say for any entrepreneur, you are giving up 1,000 days where you're going specifically hard for your business. 1,000 days is 3 years. That's 3 years. So if you start off as an associate, it could be private practice, it could be DSO setting. I did both. The private practice, starting off as an associate, it allowed me to learn how to manage my time better. I had someone that was there to kind of hold my hands, and I had a training wheel. In the corporate sector, um, unfortunately, you're going to, what she said, your speed does increase because they're pushing you. Sometimes they push you in a way where you get to be uncomfortable and you make a mistake. So there's basically good and bad associated with that. But for me, I would never advise someone to come straight out of dental school or specialty and go straight into owning your own private practice unless you have a family member or somebody who's right there with you to hold your hands through it, because it is definitely a lot of bumps and bruises along the way, and that could really hurt your confidence. And I would never want that for anybody.
and then you can get suckered into, sometimes someone wants to be, a company that says, oh, well, I can show you I'm a consultant. I can do that. You just pay me $25,000, $30,000. And they're just taking your money.
Yeah.
So it's just so many things to consider like that. But I don't know about you guys, but I don't recall getting taking any business courses in dental school. Did you?
Nope.
Has that changed?
Nope. Mine was
You can do like me. My husband is a
oh,
business
okay. So
guy,
you
so
lucked up. Mine was
I learned
at a
so much
DSO setting.
from him.
I was asking, I started looking to see how they would build stuff, to see they put all the codes in there correctly. Like how if I'm doing a root canal, are you billing the limited exam, the pulp vitality test, the root canal treatment? I started asking those questions in residency. I actually started asking questions about restorations, how to bill it out in dental school at Detroit Mercy. So while you guys are there, you guys have to kind of, you're learning your clinical aspect of it. If you guys are intrigued about the business aspect of things, slowly start off by understanding what codes they are putting for your treatment plan for your patients when you go to take your, treat your patients and do clinical restorative treatment or root canals or extractions. It's not anything for you to memorize now, but you start to become familiar with it over time.
And we had another question. What would you recommend doing if not accepted into residency for the first time? More specifically, someone said, I'm a D4 and I did not match this cycle for an orthodontic residency. I'm going to apply again in May. However, would you recommend doing an AGD or working for a year in the meantime?
Yes. Um, I don't know for ortho, but I can only talk for oral surgery. GPR or oral surgery fellowship is always something to consider. And even dental anesthesia. Everybody forgets about dental anesthesia. Because you got to remember what we do every day is, especially in the clinical setting, we're going to be administering anesthesia on patients, IV sedation, deep sedation, moderate, whatever. I think that knowledge is definitely good to have, but I'm always going to be an advocate for an AEGD or a GPR when you're in that transitional year. The more knowledge that you have, the better in anything. And I think that will strengthen your education or excuse me, strengthen your application when regarding applying to that specialty residency that you're trying to do.
Yeah, I would definitely say like try to get involved in um, things with the specialty. So if you didn't match to ortho, I would say if you're not a member of like the AAO, maybe try to join like their club and see what continuing education classes they have as well. I think when I was applying to residencies, program directors would ask like, have you done any like courses within like the specialty that you're interested? Um, Either shadowing at the office or trying to work in that type of office. Maybe it could be a general dentist office with ortho as well, and maybe you could like work with ortho, do minor treatment cases with them. Um, so trying to get yourself into the specialty other ways, like showing that you're interested, definitely helps. Um, Especially if it's something that you can document and show when you're applying again. And that can definitely strengthen your application for pediatrics. I definitely try to do like pedo fellowships, and I did the pedo CEs and try to work at um, I joined like smile like a mobile dental clinic for it, and I was working doing that even though like I was a general dentist. They needed people to work and I was willing to work with the kids. So doing anything that you can immerse yourself into the specialty, showing that you're really interested when applying.
I think with endo, it's I'm starting to see the trend now that they're choosing more people that come out of AGDs and GPR programs. Um, if you're coming straight out of school, it's usually because you're accepted by a program that is associated with your school. But if you didn't match or get in the first time around, I would say go to the AAE conference. There's so many people at these endo conferences. They have alumni receptions, and all you need to do is find one person to introduce you to the director or an alumni that has a very good standing with the program director. And if they remember you, you leave a good impression, they remember you, and of course, the follow up, they usually will remember to invite you for the interview when you apply again. In the interview process, I know for case, even though we have our attendings that are really much very involved in the interview process, the residents could also kind of tell the attendings if you were teachable. Did you come across aggressive? Are you the type of resident that's going to come in there and just create a whole bunch of problems because you think you know everything? And that's an aspect of residency that sometimes they don't say, because sometimes the residents do have a little bit of input in terms, is this going to be a blended family where our program continues to just coast in excellence, right?
I'll agree with that too. I don't really have that much information on what to do in between because I went straight from dental school to ortho residency. But I do know a lot of people who did do some GPRs or did practice for a couple years. But I do know that we did have people just come and hang out in our residency at Case. So we just have people come and shadow and hang out with us a little bit. So at least when it is that time, like she said, like the person may remember your name and remember your face when they do see your application come across the desk, like, oh yeah, I remember her. She was nice. She came up here. She helped out a little bit. So just kind of like put yourself out there, put your, so someone can remember you.
And how can you present yourself as a competitive applicant for ortho and other specialties if you decide to go straight into the workforce right after school or after GPR/ADD?
You said, can you repeat it? You said to make yourself a strong candidate. Is that what you said?
Yeah, competitive applicant.
I would say that the same thing, like shadowing, or even I worked at a couple different offices. So like during like my summer breaks and stuff, like I would just go and actually get like a little, like necessarily an assistant job, because I didn't go like to assistant school, but I would have the doctor. They'll show you, like a lot of orthodontists, they'll just show you how to do it. You just come and hang out with them, and so then when they see it on your application, it's like, oh, you're serious, like you've actually got some type of experience. I think um, I feel like that's pretty much it. I know people did like research. Also a few other people did like, your master's programs and stuff like that to kind of make you competitive. But I would say once you get to applying to residency, everybody's pretty much a good candidate. And so I think how she was saying, the residents kind of have what do you say, like a say so. I do recall having that. So when really, just if you really want to go to a certain school, I just would say honestly just go up there, because it's kind of about the person. Everybody has good grades at this point. Everybody, are kind of already on the same level for you even to be applying to a residency. So it's more so about a personable a relationship, I believe.
Yeah, because at the end of the day, when you're in these residencies 2, 3, 4 years, it's about, can I get along with this person for that many years? You know, do I feel like if they're in my program, will they do the job that needs to be done to make it easier on everyone else? So yeah, I definitely agree with Raven as far as that.
And how do you manage financing
That's not the
residency? Sorry?
Oh, well, oral surgery, you get paid.
And
So
hospital-based pediatrics, you get paid.
yeah.
But I also practice on the weekends because I was a general dentist. I would practice on the weekends after my GPR. Well, not my GPR, after my pediatric residency. I was a general dentist. So I would do general dentistry on the side um, on the weekends. And I also would do, so I guess like work as an attending as in the general dentistry um, section. So yeah, finding other ways to make some money is helpful. Um,
But that's
it's
program
not always the
specific.
easiest thing to do, but
One
Yeah.
good thing about, I know a lot of other specialty, they pay you guys. Like you said, you got paid. Ortho does not pay you, like at all. I think we got like $1,500 our last year in residency. And I'm like, what am I doing with $1,000? Like, I don't know. I,
Hey, not
That's case,
no, it's
Raven. That's
maybe like
case.
it's like two or three that pay residency, ortho residency in general. And Case Western gives you like $1,500 your third your in your last semester there. So just like every other, way we did financial aid. And I mean, you're going to come out with a lot of loans unless you got some friends and parents with a lot of money. But I financed all my stuff through my regular student loans, just like I did through dental school. But ortho residency does not pay.
Listen, I lost blood. Like I had to go donate blood. At Case Western, I mean, I lost so much weight just because I mean, you're living on loans and you don't want to take at that point in time, I don't want to keep compounding my loans on what I've already had. But you're as a specialist, it's a rewarding career. You will be in a position where you can afford what you're doing as long as you manage your money well.
But I'm
And
but
be
I'm glad that this conversation is being had, because it just makes you realize that our life is so different. Like, when we think about like some of our colleagues might be third generation doctor. So that was not the case for me. So yeah. So I just having this conversation, like I honestly didn't know ortho didn't get paid. I thought it was just a few of them that didn't get paid.
Yeah, I think it's only one endo program in the country that gets paid, and that's in New York. I think Lutheran it is. Yeah.
So the match for PEDS residency comes out this Friday. As you know, this can be tough times as there's so much to anticipate. Do you have any advice for us who have applied and are waiting for this big day?
Have your bottle of champagne ready.
Look, no
Yeah.
matter what, no matter what,
Yeah. If you
because
don't
even
get in, pop the bottle. If you get in, pop the bottle.
you worked hard to get where you are, and some of these programs, it's not even about what you know, it's who you know. So these program directors will take, from like colleagues, children, or people like that work at other institutions that they vouch for. So at the end of the day, you got to celebrate yourself and that you're chasing your goals. Because I did not match my first time with pediatrics and I was devastated. But at the end of the day, I knew like, if I really want to work with kids, I can still work with kids. You can be a general dentist and still work with kids. It may not be how you want. That's with dentistry, you can still do a little bit of everything. Like if you want to do oral surgery, you can still do oral surgery. You can pick what you want to do with dentistry. You may not be able to do the breadth of things initially, but if you really want to pursue that, you can, there's always another year. So claim it in advance, you will match to your program, but if you don't, know that if it's meant for you, it will still be for you. And hold your head high through the whole process.
And I just want to say again, y'all can unmute and ask your questions. There are a lot coming in, just letting you know. So how do you handle residencies that do not want to babysit or hold your hand as you're learning the skills needed?
No residency is going to babysit you or hold your hand. There's no syllabus that you go in there with. You have to be very proactive with how you handle things. Like I said, for oral surgery, depending on what rotation I'm on, that was the opportunity to learn independently about what was going on. If I'm on internal medicine, if I was on anesthesia, I have to kind of learn as I go. You have to learn as you go, depending on the patient that you're seeing, looking up whatever illness or medical issue that they have so that you can know everything about it when you present that patient to your attending. So it's really about being very self-sufficient in the residency program, because my program was very resident run. So we had to manage pretty much everything that goes on, from the patient to our schedules to vacation to everything that was pretty much ran amongst us. And if we had to get the attending involved, then they were not happy. So basically they're like, you need to go up the chain and you need to talk to go up to your whoever the person is next to you. And if that can't get the job, then go to your chief resident before you come to me as the attending. So it's you just basically being very self-efficient and self-dependent.
And as far as the match process goes, can you apply to different specialties in the same cycle? Like, can you apply to ortho and a GPR/AGD as a backup plan? If I could repeat that, as far as match process goes, can you apply to different specialties in the same cycle?
You can apply to different specialties in the same cycle. You just got to have the money. Every application is very expensive. Um, I don't remember how much it was, but I know like the first application maybe $100, and then every other school is like 75. And then sometimes each program may have their own internal. So this is just like for the past website, I believe. But then each program may have additional fees on top of that. Sometimes these programs also have you writing essays and getting certain letters of recommendation. So if you could do it, why not? I've known people that have applied to two different specialties in the same cycle, but then what happens when you got a match? So it would be better to make up your mind beforehand, so you're not choosing between the specialties, but because like if you get into both, like which one are you gonna go to? But it can be done. It's just should you do it?
And Alexis, you
And I'm
can go
sure.
ahead and answer. Sorry, you could continue.
No, I was just gonna say, I'm sure people are already busy, like trying to, just get through school. So adding, applying to multiple programs and then going on multiple interviews. I would say that's one thing I wish somebody would have warned me, like how expensive the interview application process is, than like flying out to these places when you interview with them and lodging. Like, where is the money coming from? So I would just be mindful of those unexpected expenses.
Alexis?
Hi, okay, I just want to ask a question based on what Dr. Osborne said. So I know after speaking with one of the PEDS directors here at Meharry, she was saying, if we can to apply to like 10 to 15 schools. And so I was just trying to see like, is that a truly like a reasonable number? Because what came to my head was like money. Like what like how will that work? You know what I mean? Because I went ahead and like made the list, but it was like I obviously do have my top three based upon, the research I've done, whether I don't want hospital based and like just location, stuff like that. So do you recommend the 10 to 15 and that can go for any specialty too?
I did. I heard it was the same for us, and I think I did apply to like 10 schools. 15, I feel like that may be a bit much and gets really expensive. Also, you don't even want to go to 10 different cities, just depending on what schools that you did apply to. Um, I just had a brain fart. But I would say on use the schools that that you said like your top three. Also, I would tell you to. I know some of you guys are from Meharry or like other different schools. Some schools kind of, not to say they have some form of relationship with the dental school, because I know Case kind of Western kind of had a relationship with Meharry. I know some schools have relationships with like Howard or Tough or whatever. I would just say make sure you are also applying to the schools that your dental school or residencies that your dental school kind of has a relationship with. And you can also I mean, it kind of sucks in a little bit, but you can also see the past residents that they chose. Like if you're applying to like a Cali school, you can kind of see that all the residents that they chose were from a California school or something like that. So be mindful when you are, not to tell you to not apply to a school that you want to, just also make sure you're adding in that 10 or 15 schools that that has an acceptance rate from your dental school, or even and I don't, this kind of sucks too, even people who look like you. I know a lot of other residencies didn't even have women in their programs, and you have not seen a woman in their program in 10 years. Like I went on a wall at Case and it was like one girl, so many for whatever. They always pick one girl in each like each class. And in my class of 5, I was the only girl and there was 4 guys. So again, kind of keep those things in mind because the goal is obviously to match. So make sure apply to schools that also have relationships with your dental school.
So, Dr. Alexander, you kind of answered this a bit, but what factors did you consider when choosing the program you applied to?
Um, First, I thought about where I wanted to stay. I also looked at the cost. Um, what if that program had like a master's or not? Um, what else did I look at? The relationship that my Meharry had with different other schools, and I kind of figured out those were the 4 things. I ended up going to Case, which I feel like is a great ortho program, but didn't like Ohio. But again, the goal was to be an orthodontist, so you do what you have to do for that short period of time. But mostly, I looked at place, relationship, and the cost. And the residency was one of the lesser expensive ortho residency programs too, and also time, because some programs are like 2 years, some are 3 years, um, and then the master's course as well, or
Yeah.
degree that you have to get the
And the
master's
culture
degree as well.
Mm-hmm.
I think culture is very big to look at when you go to these schools. And when I say culture, I mean like, you know, when Raven was saying have they had how do they react? How do they act with women? How do they act with a black woman? And you know, am I gonna get side-eyed as soon as I walk into the clinic and they ain't seen a black person in 20 years? Because I've been on a rotation like that where I was like the only black person in the whole hospital. And so it's like, oh, okay, this is where we are. Well, all right. So that's important to know because then that's how you know, of course, how the residents are going to interact with you, but how the attendings are going to interact with you as well. Are you going to be getting negative reviews because they just don't understand how you might respond to a certain way because of your dialect or, you know, just little things that we do as a culture. So I think that's
That's why I
important.
also said visit the schools that you want to go to. So those top three that one of you, a lady said that you wanted to go to that school. Because you may get there and even just the feel of the school. I thought I wanted to go to one program, and I went there, and just just the aura, like the feel of the program didn't really sit well with me. And that I just can feel like this is not where I actually want to be or the environment that I want to be in. So make sure, again, go to those schools, see who those professors are, see who the current residents are as well.
Thank you.
And how did slash do you balance being a wife slash mother and a specialist or resident?
I think for me, I'm very fortunate. I did all my training in Tennessee, but I'm from Texas. We moved back to Texas. So I would not advise to do it the way I did it, but I did it and we got it done. So when I was in my transitional year, when I graduated residency, I stayed on at staff for a year at Meharry as a you know as in the residency and with the students. And then I was pregnant during that year. I moved to Texas when I was pregnant. I started revamping or getting stuff ready for my private practice and like literally had a baby and started my practice. Practice. So I did a lot. I did a whole bunch. But you know, I say that to say that it actually worked out because I was transitioning. So I worked at a corporate office too at that time when I transitioned. And so when you first open a practice, you're slow anyway. So I had an empty room that I turned into a nursery. I was able to see my patients. I was able to breastfeed during that time. And I was able to, because I had a babysitter come in to that empty room in between patients or when I had no patients, because remember, just open a practice, it's slow. I could actually spend some time with my daughter. Now, the second baby was a little bit different because at that point I was already established in the community. The practice has been open for a while. At that point, 4 years. So that second baby, let me tell you, that baby went to daycare 8 weeks because I can only take off 6 weeks. And my parents, luckily, they live here. That's why I say I'm very fortunate, even though it's an hour away. You have to depend on your village. If you have a village that is able to help you when you need to, you're really going to have to lean on them quite a bit. So I was very, very fortunate for being able to, you know, have a daycare down the street from my office, or being able to call on my parents as needed to help me, you know, if whatever is going on. So you're able to do it. It's going to be hard, but I think you can maneuver it. You have to figure it out, even if it's getting a nanny or something like that. It can definitely be done.
And what trends or advancements in your specialty are you most excited about? And how do you see your specialty evolving over the next 10 years? And I believe this is one of our last questions since we're wrapping things up.
I would say digital dentistry. That digital dentistry, AI, that's about to changed the game. So if you're into technology and tech, man, that's probably gonna be a new specialty. I don't know, but it really, I think that is the name of the game now. If you don't have some form of technology in your practice, especially if you're general, you're like behind. And I tell all my oral surgery colleagues all the time that we're behind because the general dentists, they're doing so much digital dentistry and they're just taking, able to do so much with it. I think that's the name of the game at this point. So if you don't have a scanner, you don't have a cone beam CT, or whatever new gadget is out there now, but I think most practices, general anyway, need at least a intraoral scanner and a cone beam if you're able to get that. Because that's just the name of the game at this point.
I
I
want
agree.
to I want to highlight what she said, but first I want to take a step back because I don't want it to go without being said. That is phenomenal that you were able to accomplish all of that while opening your practice and giving birth. Like that, y'all, I've seen
I
other
said I wouldn't
friends
recommend
do
it.
that, like that. So I commend you. I commend you, you guys. Like that lets you know the power of, what she was planning and putting together. Like that's phenomenal. That's phenomenal. Like completely phenomenal. I'm in awe. The trends and advancements, the trends. I know for us, we're starting to utilize like the 3D printers a little bit.
Mm-hmm.
As an endo, a lot of us will, or even the GPs use fiber posts. And I mean, those are, man, you come up, if you don't swear, you're going to be swearing during that treatment, trying to drill a straight line to go through the post to retreat the tooth if the patient insists on saving it. And then CBCTs, we're big on learning how to read, knowing how to read the CBCT. Even though we have a field of view that's limited, we always forget, I think, in dentistry that you're responsible for that field of view. So you do have to interpret it because a lot of the lawsuits or malpractice suits that do come through are associated with not having the correct diagnosis. They tell you that in all your malpractice insurances that you cover. So for us, it's CBCT and then 3D printers. And then I think I'm starting to see something about AI and injections. I haven't really looked into that. I'm still studying a different topic right now, but I'm starting to see AI and how they may have computed anesthetic needles that will automatically go in there and calibrate how you do your injection and make things easier.
Yeah, I hadn't seen it utilized in that way, but wow, if that is the case, then that's phenomenal. But
Yeah, it was in my co-residents, all my co-residents come from a different country. So it was my co-resident he's in South Korea. And I was like, oh wow. I was like, oh, okay. Didn't know that was coming down the pipeline.
Yeah. But yeah, digital dentistry, and you guys, since y'all are still in school or on your way to try to be in school, you're gonna really see it, because yeah, it's just that's just the way of the world now. It's digital. And then AI, like I said, tech, with AI, it's so many changes, not just clinical, but the administrative side of what we do as far as billing and your phone services and answering, texting patients, automating. I'm really into tech. So I'm always looking for ways that we can utilize it in our practice to make it easier on us, because it's so much that comes with being a practice owner. And if we can figure out a way for some type of AI or tech to answer these phones and get these patients insurance and have those,
Get the medical history. Let me get the
yeah,
medical history before
yeah,
you get to the
I'm about to
office.
create me something. So y'all gonna see me as a billionaire. I'm just gonna tell y'all now.
I just need you to complete your medical history before you get to the office. That's all.
But I got you. We're gonna find a universal way to put all that together before you even see the patient.
And Rebecca, you could take our last question.
Hey, sorry, I had a lot of questions today, but my final question is I go to a brand new school, LMU in Knoxville, and I'm in the second class. So there's no like rapport yet. No one really knows like who we are. So I just wanted to see like if you have any advice on how to make a name for myself in a school that's not really known.
Are you part of SNDA or ASDA?
I'm trying to start SNDA, but I'm the only Black one in my class. So it's kind of hard,
Oh,
but I am a part of ASDA.
okay. I would say start going to, if you get the opportunity and your school is able to say help promote you or compensate or give you a stipend to attend their conferences. That's a good way to meet other students as well. Because if you're at a new school, they may not have established a relationship with other schools yet, if, since you're interested in a residency program. But knowing other students is very helpful because I know endo is not, as far as I know, endo is not a part of Match. But the endo programs I applied to were the programs that I knew people in already through SNDA and ASTA.
Thank you.
To piggyback off of that, you can let them know that you are part of the Ambitious Dentist mentorship program. And that should help.
I'll do
But
that.
so that is it for today. Thank you again, everyone. I hope this discussion was helpful. Thank you, doctors, for taking the time out to answer all our questions. Y'all were amazing. And yeah, I hope you all have a great night. And don't forget to follow us on Instagram at The Ambitious Dentist.
For any Deltas, happy Founders Day weekend.
Yes.
Thank you, everyone.
Have a good
Thank
night.
you.
Thank you.
Thank you.
Thank you.
Thank you.
Oh, and can I just say, if anyone wants to reach out to us, you can always find me on social media at Dr. Portia.
Definitely
Usually I'm on
do that.
Instagram. I've connected with a couple of you guys on Instagram. One of my mentees was on the call tonight. I texted her the link as soon as I got it.
Oh, that's so sweet. Thank you for your promotion. So you've been posting us on your Instagram. That's been awesome. Thank you. Have a great night. Dilly, if you could stay on.
Good night.
Okay, just making sure. Hello, secretaries. Hold on, let's see.
I was
How do I
almost
stop?
about to leave. I was about to press the leave, and you're like, delete. I'm like, oh,
Wait, how do I stop recording?
Why'd you